Well, so far this year, we've seen a spike in flu cases and other respiratory illnesses. According to the CDC, cases are particularly high in southern states, including right here in Louisiana. When it comes to COVID, cases are leveling across the state. In the latest weekly update, the Louisiana Health Department confirmed just over 2,300 new COVID cases and 24 additional deaths. An average of 112 COVID patients are being treated in hospitals. And in efforts to keep COVID numbers down and protect your family from the flu, officials are hosting another vaccination event this weekend. That's at Joe Brown Recreation Center Saturday on Reed. Nurses will be providing free flu shots, COVID vaccines, and boosters. And this morning, we're learning about some new research that could lead to better protection from COVID-19. Joining me today is WWL-TV medical correspondent Dr. Corey Hebert with those details on the latest efforts to fight COVID. Thanks for joining us this morning.
Thank you. Aren't you tired of this?
We are so tired of it.
I'm so tired of it.
Yeah,
but
no,
I
think everybody's tired of talking about it.
If it's rare and it's happening to rare people that are happening to die rarely,
yes.
Okay? If it happens to you, though, it's 100%.
There you go.
Okay, so we can't stop, doing all the research. So I want to just tell you some good news about COVID.
Okay.
The fact that we have some new vaccines on the horizon, one of them from a group at Harvard University, and what they have decided to do is they have really used a mice protein.
Okay.
And then it gets very complicated, but they use this mice protein and they inject it, and then it has known at this point to be able to fight and block all known variants of COVID-19.
Now that is huge, right?
Alpha,
because
beta, gamma, delta, epsilon, zeta,
every
eta,
single,
kappa, lambda,
all
nu, all
of
that.
them. They're
all
friends,
that.
they're cousins, all of them.
All that, okay.
Which is phenomenal in this fight because so far we have seen sometimes some of those variants are not impacted.
That's right.
By
And
the
right
protection.
now, I have family members that have gotten COVID and have gotten very sick, even recently. So it's important that we continue to do this research. The second one, though, because I hate needles.
You do?
I
No,
hate,
Dr. Hebert.
but I get them, but I hate them. But I like nasal vaccines, and
You
there's
do?
a new nasal vaccine
Okay.
that's going to be coming through the pipeline, and they used hamsters for this one.
Okay.
But what's called the prime and spike. So basically, what you do is you get one dose of IM, which is all the rest of the doses have been in all the other vaccines. You get them intramuscular, IM, and the folks at Yale said, well, you do that, but then you come back with the nasal vaccine, and that has been shown to really boost your immunity through this ACE receptor, blah, blah, blah. The point is that we got some stuff in the pipeline, and you need to still be careful because you can still get this. And as you saw, Sheba said, the results out there, we are seeing people dying, and we just don't want this. So we do have good news that we got new stuff on the way.
That is good news. All right, help me with the nasal vaccine because I don't think I've had one of those. This is not, it makes me think of the first COVID test when it went all the way up.
Yeah, no.
Which
You
was
remember
terrible.
there was a flu vaccine that people used to routinely get,
Okay.
and there was a nasal vaccine, and I really loved it.
Is it uncomfortable?
No, it's just
Oh, it's not.
No, it's not like a nasal, like when they put a needle in your
Yeah.
nose. No, it's a spray.
Okay,
It's
okay,
a spray, like a Nasonex.
Like a nasal spray,
Yeah,
okay.
yeah, it's just a spray.
That is much better.
And it is. And let me tell you something. COVID gets in through your nose.
Right.
So that's the point. It's going to start attacking as soon as it gets in, and then it could really stop the spread before it got really bad in the body. So, and
Okay.
more people will go get it because it doesn't hurt.
There you go. All right, well, let's switch gears and talk about cold drinks.
Oh, we're going to switch some
Yeah,
gears.
he's going to rain on everybody's parade this morning. He doesn't want y'all drinking cold drinks.
That's right. I've called soda.
Or soda, whatever you call them. You hear I call them cold drinks.
I've called soda the devil's urine. I've called it everything.
Not the devil's urine.
And you know why?
Why?
Because back in the day, we used to take soda and pour it on a battery in your car. When your car wouldn't start, it'd eat all the acid off.
Oh, yeah, I have done
So
that.
what is that
Okay.
doing to your colon, right? Well,
Tearing it up.
Tearing it up. Well, 451,743 people across 10 countries.
Okay.
All right? If you drank 2 or more glasses of soda in a day, you had increased death from circulatory illnesses. And if you drank 1 or more, you had increased death from digestive problems, liver, appendix, and pancreas, and intestine. Seriously, you really gotta cut the soft drinks. Yeah, I did say devil's urine. I'm sorry, but I need you to stop.
And we know, easier said than done, though, for folks who do drink this multiple times a day. For some people, this is hard. How do you cut back quickly?
You stop.
Immediately.
That's
Cold
it.
turkey. All right,
Cold
he's
turkey.
not
Be
giving
done
us
with
any breaks this morning.
No.
Don't drink the devil's urine.
There you go.
Let's get over
Be
the
done
pain.
with it.